What does contrast dye do during a pancreas quart scan? Imagine trying to see tiny details in a complex puzzle. That's what contrast dye does during a pancreas quart scan. It helps doctors get a clearer picture of the pancreas and nearby blood vessels. When a contrast dye is used, it makes blood vessels and tissues stand out more on the images. This is especially helpful for spotting pancreatic tumors, which can be hard to see on regular scans. The contrast dye used is usually an iodine-based substance. It is injected into a vein, and then the scan is taken in different phases. The first phase, called the arterial phase, happens about 30 seconds after the injection. During this time, the dye highlights the arteries that supply blood to the pancreas, such as the celiac axis and the superior mesenteric artery. This helps doctors see if the tumor has grown into these blood vessels. The second phase, called the portal venous phase, occurs around 60 to 70 seconds after the injection. In this phase, the dye makes the pancreas itself more visible. It also highlights the portal vein and splenic vein, which are important blood vessels near the pancreas. This phase helps distinguish normal pancreatic tissue from tumors, which usually do not take up the dye as well because they are hypovascular, meaning they have fewer blood vessels. This difference in blood flow makes tumors appear darker or less enhanced compared to healthy tissue. Using contrast dye during a pancreas quart scan is essential for accurate diagnosis. It helps identify the size and location of tumors, shows whether the cancer has spread to nearby blood vessels, and detects metastases, especially in the liver. Without contrast, the images are less detailed and less useful for diagnosing pancreatic cancer. This technique is considered the standard for pancreatic imaging because it provides detailed, high-quality images that guide treatment decisions. It allows doctors to plan surgery or other treatments more effectively. It is important to note that some people cannot receive contrast dye, such as those with kidney problems or allergies. In those cases, non-contrast scans may be used, but they are less sensitive for detecting tumors. In summary, contrast dye acts as a visual enhancer during a pancreas quart scan. It highlights blood flow and tissue differences, making it easier to find and understand pancreatic abnormalities. Always consult with a healthcare professional to determine the best imaging approach for your specific situation.